Kia ora, my name is Ramon Pink. I'm Medical Officer of Health for Canterbury, and I'd like to talk briefly to you about influenza, and I'd like to bring home to you the importance of protecting yourself against getting this illness and the benefits that that brings, not only to yourself but to your family, to your friends, and also to the patients that you may work with. First of all, what is influenza? Influenza is a virus. It's an illness that is a lot more serious than most think. It's not just your common cold, but it's an illness that can keep you off your feet and in bed for a number of days. It can have severe complications and it can even cause death. In fact, it has been estimated that there are over 400 deaths a year as a result of influenza infection, and this is more than our national road toll. So this is a significant illness. How do you get influenza? Well, influenza, like many of the infectious diseases, is passed on through small droplets. So if you have the illness, when you cough or when you sneeze, the droplets that you sneeze from your nose or cough from your mouth go into the air, and those around you can breathe those in, and they eventually become unwell with the illness too. It is a contagious disease, and so if someone has it in your household or someone has it at your workplace, it's highly likely that you'll also become unwell with influenza. It's to that end that it's important, because it's highly contagious and because of the impact it can have on those around you, that you protect yourself from influenza. So when you get influenza, what are the symptoms that you have? As I mentioned earlier, it is a lot worse than just your common cold. So you'll have a sore throat, you'll have cough, runny eyes and a runny nose. You have significant fever and chills, or rigors, and you'll also feel significantly fatigued. And all of these symptoms are combined to make you feel pretty unwell and require you to be in bed and resting for several days. Recovery from the flu can take a couple of weeks or several weeks, and again that just speaks to the severity of the illness. For some, you can get complications, which means getting infection in your chest, bronchitis or pneumonia, and for that you really need to see your doctor and have treatment. For some, it may require hospitalisation because those complications, as I mentioned earlier, can be severe and cause death. So it's a severe illness. How do you protect yourself from it? And what I want to promote today is having the influenza vaccine. The vaccine is prepared every year, and that's because the influenza virus is changing all the time. It doesn't stay the same. In other words, if you have the influenza illness once, it doesn't mean that you are immune from it for the rest of your life. It's one of those conditions that is constantly changing because of the changing virus, and therefore you really need to have the vaccine each year. Every year the vaccine is different because of the difference in circulating viruses. So we've talked about the importance of protecting yourself and getting the vaccine. How do you get the vaccine? Well, you need to identify who your authorised vaccinator is in the area that you work in, and talk to him or her about getting the flu vaccine, or attend one of the clinics that are going to be promoted around the DHB campus, and you can go there and get your flu vaccine. It takes a couple of weeks for the vaccine to become effective, and so there is still a risk of you getting influenza before the vaccine kicks in. And so that's why we're encouraging you to get your vaccine as early as you can to give yourself maximum protection and reduce the risk of getting influenza. Some people say, well, getting the vaccine, don't I get sick from that? And there is a common myth that the vaccine causes the flu. Well, it doesn't. The vaccine does not contain the flu virus, and therefore it can't give you influenza. Most people generally tolerate the vaccine well. Some can become a little unwell. You can get symptoms of perhaps some tiredness, or at the site where the injection is put into your arm, there can be some redness. In those situations, if you do become unwell, take a little more fluids. You might need to rest. You might need to, if it is too severe, talk to your doctor or medical professional so that the reaction can be recorded and further treatment can be given to you if required. But this is very rare. Another thing is that if you're travelling, can I encourage you to get the influenza vaccine, because if you're travelling overseas, accessing medical care can be difficult. And so if you have the flu vaccine, recognising that the vaccine is produced to fight the viruses that are circling globally, the vaccine can protect you when you are travelling in another country. As well as getting vaccinated against influenza, there are some simple practices, which I'm sure you're all familiar with, that you can do, that we can do, to prevent the spread of influenza. The first, and something which is a basic common hygiene practice, is washing of hands. It's simple, I know, but washing hands not only prevents influenza, but a myriad of communicable diseases. So stick to the basics, wash your hands. Also, blowing your nose. Use a tissue and throw it away as soon as you finish. And lastly, when you're going to cough, if you're going to cough or if you're going to sneeze or cough into your elbow. By sneezing into the elbow, it means that you're not going to infect your hands and reduces the likely transmission of viruses onto surfaces where they can be picked up by those around you. So in summary, influenza is an important illness. It's an illness that has impacts on individuals and on our community. For us here in Christchurch, we already have challenges. We need to minimise the challenges that we're going to face and promote having a healthy winter season. Think about influenza. Think about the hygiene processes, those simple things, and encourage those around you, your family and your friends and your colleagues. Remind them of those simple hygiene processes. And finally, but most importantly, ensure that you get your influenza vaccine this year. Identify your authorised vaccinator or go to the clinics that are being promoted by the Occupational Health Service. Kia ora. Have a happy and safe winter.